But that's the lungs. But we haven't talked about the damage to blood vessels. The risks for heart attack, there are several of them, well-recognised risk factors. There's high blood pressure, high cholesterol, diabetes, smoking. Smoking is the most important preventable risk factor in the world today. We estimate by the year 2025 that there will be 10 million deaths directly related to smoking heart disease. In Australia, that translates to around 13% of deaths per year are directly related to heart disease as influenced by smoking. In other words, if there was no smoking, you'd tremendously reduce the number of people with heart attack.
Well, how's it affecting? How does the smoke get into the bloodstream or into the arteries?
The process where smoking causes disease is called atherosclerosis, which is, in simple terms, means the clogging of arteries. The process starts early in life in many people, and if I can show you a model here of a normal artery, and the very beginning of the process of clogging of the artery here, this yellow plaque, which is made up of cholesterol and other fibrofatty substances, and over a period of several years, usually a decade or so, that process increases to a point where, in this model here, you can see the plaque has developed further. And then with the risk factors such as smoking, particularly smoking, this is greatly accelerated to the point where perhaps a decade or two later you're having very substantial plaque formation, and here you can see the artery is approximately 50% blocked up, and then later on 90% blocked up. At this point the patient would definitely have symptoms of chest pain, angina if you like, due to this clogging up of the artery. But even at this point, where the artery is perhaps only 50% blocked, the patient is at risk of suddenly blocking off that artery by a blood clot that lands in here and blocks the artery off, and they have a heart attack or even can have a period of just drop dead.
We haven't mentioned, I think, carbon monoxide. The same stuff that comes out of car exhaust pipes is a component of cigarette smoke. It has the effect of combining with hemoglobin in red cells. These are responsible for carriage of oxygen, and they're unable to do their job while ever they're linked with carbon monoxide. And it would significantly reduce our oxygen carrying capacity. We're virtually made anemic by the fact that we're smoking. So, to the point where a heavy smoker would have up to 10% of the red cells paralysed. So effectively they are, although they look nice and pink, effectively they are anemic to the degree of 90%, because 10% is locked up there. So that's one of the things that of course also affects your energy levels, your thinking, your tissues generally. Your tissues are being fed through narrow pipes sometime with blood that's partly paralysed.
You know, an interesting thing is that the body tells its own story. You've only got to look at the body and you can see what's happening inside.
Yes, I think that's true. I mean, everyone knows about nicotine staining, and that's unfortunately still quite common. But also there's premature aging of the skin. When you see people around with prematurely wrinkled skin, you can bet either they've had very much an outdoor life, or they've been smokers, or both. And those cause damage to the collagen in the skin and give you the wrinkled skin. A good reason, incidentally, why young women may be persuaded to give up smoking, because they don't like having wrinkled skin.
We've established pretty clearly that smoking is a poison. Chris, it's interesting that we're all scared of poisons. We're scared of snakes. We don't get in the way of snakes because they know that they'll poison us and kill us. So why do we accept the poison that is cigarette smoking?
Well, I think we're human, and we focus on what we're prepared to deal with and what's comfortable. So we can be terrified of crocodiles or snakes or spiders, safe perhaps in the knowledge that it's very, very rare. But we tend to ignore the fact that we're constantly being poisoned by cigarette smoke.
Tobacco smoking is the single largest preventable cause of chronic respiratory disease in our community. It accounts for over 80% of the cases of lung cancer and chronic obstructive pulmonary disease.
If we make up our mind to stop smoking, can we actually repair the body? What are the benefits?
There's not a straight answer to that. Some things happen fairly quickly. We regain our exercise capacity fairly quickly. Lung damage, The lungs don't really repair as some other tissues in the body do. So the best that can happen there is that the damage stays no worse.
I'd like to show you from this chart. This is the time course for people who have smoked and who continue to smoke. What's really important is that the symptoms of chronic bronchitis and emphysema occur late, when up to 50% of function has been lost, and therefore emphasizes the need to stop smoking early, before this is lost. The second point is that wherever one stops, be it at a relatively early stage or at a late stage in the loss of function, there's a benefit because the loss of function thereafter is slowed down.
Vascular damage, damage to blood vessels, used to be thought to be irreversible, but there's now some evidence that given the passage of time and keeping cholesterol levels down, keeping smoking away, allows blood vessels to recanalize.
With treatment, and that may be stopping smoking and working on risk factors, there is a lot of evidence that there can be some regression of this plaque, particularly with aggressive treatment of risk factors, not to the point where it dissolves away, because that is impossible. It has taken 20 or 30 years to get there, but there is some evidence of regression. But more important than that, there is powerful evidence that suggests that it slows down progression of disease.
Risks of cancer, I think, revert to normal, not within weeks or months, but within a year or two. So that the cancer risk, lung cancer, bladder cancer, whatever, after a few years reverts to the risk for the rest of us.
Now, clearly you can't just, I mean you can, I suppose some people do just decide that they'll stop smoking and have got a very strong will.
Pretty rare.
Most of us are pretty ordinary. Yeah. So I imagine you've got to really, you almost need to go to a planner, don't you? Like a bit like planning an income thing.
Yeah, that's true. And I would always emphasise that the decision has got to be the decision of the smoker, him or herself. It's not a decision that's foisted on the person by outside influences. So that's the one key thing.
Yeah, absolutely. When I have